And we are live. It's Dr. J here. We are on YouTube live Q&A session here today. Excited to be with you. Hope everyone's having a fabulous Thursday. What's going on? Put your comments down below. Make sure you smash that like button. Really helps the YouTube algorithm. And today's going to be a topic of conversation on whatever you guys want. So feel free and put it in the chat section and we can dive in. All right, so what's on my radar here, kind of clinically with patient wins or patient improvements this week? I would just say number one is digestion. Number one is digestion and having regular bowel movements. One of the first things that you can look at is in your own health, are you able to digest and break down and assimilate the food that you're eating? Number one, are you having regular BMs? How does your stools look? There's a lot of undigested food particle in there. Is it floating? If it's floating, that means there's potential fat malabsorption. If it's excessively mucousy, it means there could be some inflammation in the gut. The inflammation could be from just poor digestion, food allergens, infections. Mucus is kind of non-specific, but it does tell us there's some level of inflammation there. And of course, having regular bowel movements. If we're not evacuating every day, ideally about 12 inches of stool. I mean, if you're a bigger person, you may have more stool. And that means we're getting toxins out. Half of your stool is also bacteria. So we have bacteria in your stool. We are flushing all this out. So we want to have regular BMs every day. If we're not having regular BMs, there's a good chance that we could be reabsorbing a lot of those toxins. That would not be ideal. So just keep that in the back of your head of, things on your checklist is number one, are you digesting your food? Number two, are you having regular BMs? And then how do your stools look? That's really important. When we look at a Bristol stool chart, it's got a number 1 through 7 on there. 1's on the pure constipated side, rabbit pellets. 7's on the pure diarrhea side, liquid. 4's right in the middle, perfect. And then as you go closer to 5, it gets a little bit more mushy to liquid. As you go from 4 down to 3 to 1, it gets a little bit more harder and pebbly at the extreme. So that kind of gives you an idea. When you're going on the extreme low side, on the constipated side, there could be not enough hydration. There could also be not enough fiber. When you're going on the extreme diarrhea side, transit time is too fast, and there could be some level of inflammation from food, from infections, or just poor digestive breakdown anyway. And you can still have poor digestion and be on the constipated side as well. But typically when you're constipated and your stools are more pebbly, you obviously have a longer transit time. When you have a longer transit time, you typically, there's enough time to digest the food. Where when you're on the diarrhea side, it's being flushed out too fast where it's impossible to absorb a lot of those foods and minerals. So typically you're going to see more of the malnutrition and the malabsorption on the diarrhea side. And you could still have not great digestion or not great absorption on the constipated side where it's pebbly on the 1, 2 for that Bristol stool chart, but it's just, less likely. But in general, we want to have good digestion. 12 inches of stool a day, maybe even a couple of smaller ones in between is totally fine. That maybe add up to 12, that's fine as well. So let's kind of dive in. Any questions here that you guys want to chime in on? I'm going to pull up my chat window here and we can get going. So off the bats, how do you reverse scarring of the liver? Well, it depends on what the scarring is caused from. Liver is one of those organs that regenerates very well. So if the liver is scarred from a hepatitis infection, then you want to address the underlying infection. If it's the most common reason why your liver would be scarred or stressed, it's going to be alcohol and it's going to be high levels of fructose. So you'd want to work on cutting those stressors out. That's automatically going to help. And then if you want more support, you can do things like milk thistle, which is like a liver tonifier. We can do things like sulfur-based amino acids, N-acetylcysteine, glutathione to help support the phase 2 detoxification pathways and help with oxidative stress. Do you ever test the gut sooner? Opinion. Well, I test it right on day 1. I want to see kind of where we're at on day 1. We may not treat the infections on day 1, but we're definitely going to be working on better digestion on day 1, cutting out food allergens on day 1, maybe even helping to reduce inflammation if we have symptomatic observations of inflammation. Are lemons good for digestion? Yeah, lemons have citric acid in them, which will stimulate digestive juices. Lemons also have D-limonene in there, which will help with motility as well. Will help with kind of slower motility. You told me once to take GABA and magnesium to help my sleep from lucid dreams because I quit weed. How do I take it with pills, with food, dosage? It depends. Magnesium, you can go anywhere between 200 to 400 milligrams of a malate or bisglycinate, or you can go, on a natural like a mag citrate, a tablespoon or so. On the mag citrate, you may want to go just below bowel tolerance, so you may want to work it up till you start getting loose stools and then back off. On like a D-malate or a glycinate, you may not have digestive issues because you're absorbing it so well. So you just got to play around with that dose. Typically 1 to 4 of that. And then GABA, it just depends on the capsule size. I mean, you could do a couple 100 milligrams up to a gram is totally fine. There's no high limit on GABA. Any root causes for Schomburg's disease and keratosis pilaris in the same patient seems genetic. Keratosis pilaris is where the keratin in that hair follicle gets, excessively accumulates. Make sure we're digesting fat and protein and zinc and good minerals, and then we can always exfoliate as well to help get that keratin flushed out of the pores as well. Regarding Schomburg's disease, I'm not really sure what that disease entails. Anytime you get into wacky diseases, almost all the time it's an autoimmune kind of thing. So Schomburg's disease, a progressive pigmented purpuritic dermatosis, is a chronic discoloration of the skin, usually affects the legs and spreads slowly. So it would just depend upon the onset. Let's just see if there's any connection of Schomburg's disease and autoimmune. Let's see. Okay. Need to do a little bit more. I don't see an off the bat autoimmune issue here. I need to know a little bit more about it. Again, it depends. When you're born with a disease, then it's purely genetic. But if you're not born with a disease and it happens over time, then it's typically not genetic. It's really epigenetic. So the onset is really, really important. What are the foods that contain the most B1? So, B1 is nothing more than thymine. So your meats and vegetables are going to be super, super high in B vitamins. Meats and vegetables for sure. Good carbs on the autoimmune protocol. Well, of course, you have your vegetables, everything but tomatoes, potatoes, eggplants, peppers. And on the safe starch side, you could do squash, sweet potatoes. You could do yucca. You could do plantains. You could do greener bananas. Those would be, turnips, rutabaga, parsnips. Those are all good for the starchy side. Jack writes in, I've had digestive issues for a while. Now when I stand up fast, I get dizzy and also seem to be in a constant state of brain fog, even when sleeping well. Advice. So it sounds like if you're getting up fast and you get dizzy, that definitely sounds like adrenal issues. So you need to get your adrenals looked at, number one. And number two, the easiest thing that's going to be driving brain fog is going to be gut issues or gut health issues. So you really want to look at the foods and you want to look at gut infections. Again, we need to do testing before I could give you specifics on that. Laura writes in, what supplements do you suggest for MTHFR for foods? Well, MTHFR, that's methyl tetrahydrofolate reductase. So any of your leafy greens are going to have lots of rich folate that are going to be fully activated, meaning they're not going to be folic acid. They'll be in a natural folate form. Much easier to process. And then, of course, organ meats are amazing because when you have MTHFR, you want to get lots of choline. So organ meats, liver, egg yolks, or any high-quality animal products, right? Grass-fed, organic, try to keep the quality up really high. And then lots of green vegetables are going to be amazing for that. Great questions, guys. Great questions. Are varicose veins normal for an active 23-year-old? Definitely not. Like very active job, maybe sitting 4 hours a day, 7 hours sleep. If you're having varicose veins issues, you have to look at why the vein integrity is getting weak. So, of course, vitamin C is really important. Collagen is really important from a dietary perspective. Now, what's the root cause? So I would look at, is your diet poor to begin with? Are there any digestive issues where you're not absorbing all those nutrients to kind of get into your system to begin with? There are different grapeseed extracts like oligomeric proanthocyanidins called OPCs that are really helpful for vein integrity. Horse chestnut, things like that are also great. Does magnesium malate absorb easily? Yes. It's red blood vessels that die and then stack under the skin. You're talking about the Schomburg's disease? Okay. Onset and timing is everything because when symptoms start to happen, the question is, if it's a weird disease and it didn't happen at birth, it's probably not genetic. It's probably epigenetic. And so the question is, what system started to dysfunction as these symptoms started to manifest, right? It's a top-down, inside-out approach. So we look at the underlying stressors that accumulate over time. Then we look at the systems, the body systems that stop working because of the stressors, right? Hormonal, gut, detox, nutrient, mitochondria. And then as these systems stop functioning, as these systems stop functioning up here, these symptoms happen downstream. And we look at the symptoms aren't happening in isolation. They're happening because of the systems above are malfunctioning. Dr. J, what functional tests should we ask the doctor to run for my husband who's just starting to have panic attacks? Honestly, so we're talking functional tests. So you're seeing a functional medicine doctor. So you'd want to look at adrenals for sure, full cortisol rhythm, adrenals. You'd want to run an organic acid where you can look at all the neurotransmitters. So you can look at your catecholamines like vanilmandelate and homovanillate and serotonin and your B vitamins. And then you'd also want to look at your gut because that's where you absorb all those nutrients. So that would be great to start off with. Is there any way to know if you need to take digestive enzymes, trial and error? Well, if you have bloating or gas or digestive issues or motility issues, you definitely want to start there because if we don't have enough digestive juices or enzymes, we're not going to be able to break down our food. So definitely start there for sure and see how you do. Start low, work your way up. Best supplements to take to raise blood calcium levels. If you could do any full-fat dairy, maybe lower casein dairy like ghee or butter is great. You could do fish, salmon, especially salmon that has like a little bit of bones in there. Those are great. Leafy green vegetables, and then you could always do like a calcium dimalate, a malic acid, calcium that absorbs pretty well. And then of course you'd want to make sure you're getting enough vitamin K2 along with that, so the calcium goes into the bones. K2 helps the calcium go from the blood to the bones. Very important. K2 is going to be high in leafy greens and primarily will be very high in ghee and butter. Will water with lime juice help acidify my stomach for better digestion? It's a good starting point. It's very gentle. It's a good starting point, and then you can work up to, full-on hydrochloric acid capsules for sure. Wanting to know if I should get the gut Zoomer test. It's a helpful test for gluten sensitivity. It has some good markers in there. It just depends. I always run tests like, will the test change what I'm going to do with the patient? Because I make a lot of similar diet changes in regards to gluten, it wouldn't really change much what I'm doing. But for some people who are resistant, it can be very educational. Is it possible to reverse fatty liver? And do you have brand recommendations for blue light blocking glasses? In regards to fatty liver, I answered this earlier regarding liver scarring. Yeah, number one, you have to get the blood sugar under control. That's number one. Typically, excess fructose sugars are going to be high fructose corn syrup are going to be the big driving factors outside of like things like alcohol and destruction from alcohol. And regarding blue blocking glasses, Dave Asprey has a brand called True Dark. There's also a brand called Swanwicks or Swannies. Those are good as well. Should we avoid drinking water around meals? Yeah, I think you should, unless it's some kind of a digestive support, like something that's ginger-based to stimulate digestion. Should try to drink 10 minutes before a meal is ideal. Okay, great. Excellent. What does fast GI motility indicate? It indicates that something in the intestinal tract is irritated, right? It could be from poor digestion. It could be from some kind of toxin in the gut that's irritating it, but something is irritating the gut. Have you seen patients completely get rid of vitiligo? If so, steps. Well, yeah, vitiligo is an autoimmune condition that affects the melanin in the skin. You see Michael Jackson was common to have that, and then he took the bleaching agent and bleached his whole skin. That's why he started off in the mid-'80s with a glove on his left hand, because his vitiligo was on his left hand. So he used the glove, and then he just said hell with it, and he did the bleaching compounds that bleached his whole skin because he didn't like the vitiligo. Now, I've seen patients significantly repair on that autoimmune diet, and then there also are some pseudo-catalase creams that can be helpful that stimulate melanin regeneration. Absolutely. And I think some of the red light can be helpful, red light therapy. Thoughts on IgE food sensitivity test? I've heard that the science is iffy and basically just shows that what you've eaten. I have no food allergies, but I have food sensitivities since gut issues started. IgE is not going to be great for food sensitivities. It's more going to be anaphylactic or really strong environmental allergies that are very acute. Not going to be the best. IgG or some level of a test like an ELISA ACT or an MRT that look at other T-cell compounds are a little bit better. Not a huge fan on food allergy tests. If you're really great and you're doing awesome and you kind of have some good rotation on your diet, and then you want to see what else could there be. I like food allergy testing when you're already doing great. I don't like it when you're not even at a good place, because start with low-hanging fruit. Most times a good, solid autoimmune elimination diet does wonders. Do you find homeopathic remedies useful with young children with gut infections like toxic metals? I mean, there's a homeopathic product that I swore by for my two kids. It's called Camellia, and it's a natural anti-inflammatory. We use it for teething, and it works amazing. Camellia. So yeah, there are some good ones out there that can be useful in those kind of things, like drainage or those kind of things are helpful. Absolutely. How many bowel movements a day / 24 hours is considered normal? I say about 1 BM, but I'd say about 12 inches of stool in 24 hours. Excellent. Robert writes in, hey, Robert, hope you're doing good, man. Dr. J, my GI doc is testing me for gastroparesis. Can SIBO and Candida cause this, or is it the other way around? Yeah, it definitely can cause it. Gastroparesis is where the food just sits in your stomach too long. So taking hydrochloric acid will help a little bit. You just have to make sure you're not taking so much that you're irritating your gut. Because when your food doesn't empty naturally, too much, acidity for too long can be irritating. So try taking HCl, try taking enzymes, and then you can take natural migrating motor complex compounds. So ginger is one of the best ones. 5-HTP is great. There's an old product that's been around about 100 years called Iberogas, which is great. And again, I think we have a consult coming up, Robert, so we should chat more about that. But start with ginger. And make sure you're really digesting your foods, breaking down well, and make sure you don't go too flat too soon after bed, after you eat, because that food may come back up to your throat and burn it. Hey there. Mary writes in, my salivary cortisol at night showed 12. Reference range is less than 8. Frequent poor sleep. Heart rate, normal. High heart rate, normal thyroid test. What can I do? So you need to get with a functional medicine doctor to get an adrenal protocol dialed in to work on lowering that cortisol at night. So the things we typically would naturally use are phosphorylated serine, GABA, magnesium, ashwagandha. So you really want to get with a good doc that can kind of get a protocol dialed in to help break that down and lower that cortisol at night. Of course, just don't do excessively stimulating things. Really good food, really good diet, all those good foundational things, keeping light under control, stimulation from TV, all those things. Is heartburn common with leaky gut? Yes. Good carbs, if any, for fungal and candida infections. Yeah, keep it to mostly non-starchy vegetables. Hey, Robert, you're welcome. Hope all's well, man. Talk to you soon. All right, guys, I had to jump on a patient call. You guys have a phenomenal day, and we will be in touch tomorrow. Take care, y'all. Bye.